Pretend that you have a 7-year-old daughter and she was just diagnosed with cancer. She'll have to be in chemotherapy for 3 years, and as her parent, you were given 2 choices to reduce the side effects of chemo. You can either give your daughter 7 to 10 prescription narcotics a day, or you can give her 1 gram of medical marijuana per day. This was the case for a family in Oregon. They chose medical marijuana, but instead of having their daughter smoke, they gave her cannabis oil injected into capsules. Her daughter takes 1 pill each day and still has a normal appetite, more energy, and she seemed happier after starting the medical marijuana treatment. Injecting the oil into capsules and giving it to their daughter in the form of a pill still provides her with the benefits of medical marijuana, while still getting rid of the typical stereotype of smoking for recreational use. The parents of the girl in Oregon were ridiculed by the media and their local community for providing their daughter with medical marijuana and making her life easier for her. So if you were in her parents' shoes, what would you choose? Cancer is a widespread disease that currently has no cure. If any of you know someone that has suffered from cancer, you understand the severity of the disease and realize the misery and sorrow it can cause people. A study done at the California Pacific Medical Center in 2010 showed that medical marijuana has potential to stop breast cancer from spreading throughout the entire body and can serve as a more pleasant alternative to chemotherapy. It also greatly reduces the side effects of chemo. Medical marijuana was also shown to slow the growth of tumors in patients with brain cancer. Cancer is a worldwide disease that affects so many people that if there is any chance of finding a cure, it should be legal and available for all cancer patients. So many people are donating their time and money for further research and studies to cure cancer. Why keep something illegal that may be the solution? One of the main criticisms about medical marijuana is that it is usually smoked. But today, medical marijuana is available in capsules, as I stated before, made in edible baked goods, and can be available in vaporizers. Using any of these alternative methods can make it possible for people to use marijuana strictly for medicinal purposes without feeling as though they are committing a crime. With the recent controversy in the news in mind, how many of you can tell me that you completely trust the government? Can anybody here say that the government has been right 100% of the time? I'm quoting the Drug Enforcement Administration's own administrative judge when saying marijuana in its natural form is one of the safest therapeutically active substances known to mankind. So why is it illegal? The government categorizes marijuana as a Schedule I controlled substance, which means that it has a high potential for abuse and no accepted medical use. A review of medical literature in 2002 stated that medical marijuana has effects in the treatment of nausea, vomiting, premenstrual syndrome, unintentional weight loss, insomnia, and lack of appetite. Medical marijuana has also been found to relieve several symptoms of multiple sclerosis and spinal cord injuries. With this all being said, do you agree that medical marijuana has no medical use and should be considered a Schedule I controlled substance? Prescription drug overdose kills about 100,000 people each year. It seems these days that everyone has a prescription for some sort of medication, whether they are prescribed for a sports injury, or work, or for mental health. Prescription drugs are easy to obtain. Prescription drugs are also highly addictive and can cause a patient to rely on them even after an injury has healed, if only taken as prescribed. Ultimately, medical marijuana will be protecting the youth from easily obtaining narcotics, making it harder for them to be dealt. The effects of marijuana can be addictive for some, but they are not as likely as other drugs. For my informative speech, I told you guys about the pro-anorexia movement. One benefit of medical marijuana is an increased appetite. Use of medical marijuana stimulates a patient's metabolism, which can cause an increase in appetite. Medical marijuana could be a safe and easy cure for the growing popularity of eating disorders as well. Yes, marijuana is illegal, but so is most of the music on everyone's iPods. So does legal really mean that it's beneficial?